Welcome, my name is John Glanville and this is video number 11 in the Calmness in Mind series. In this video we're going to explore the core symptoms of anxiety, which I believe are often misunderstood and occasionally medicated inappropriately. It's a bit of a housekeeping video because although most people do understand the symptoms of anxiety, I'm still amazed that so many people don't. And I've purposely waited until this point in the course because now I can use far more complex perspectives that in the beginning you may have rejected. And many of you have already contacted me to say that as you've embraced these understandings, your anxiety has begun to lessen. And some of your self-sabotaging behaviours are slowly backing down, or at least you're beginning to see that there really are sabotaging behaviours out there. How did this happen? Well, some of it has come by you thinking differently, seeing things differently, tricking your body, letting things go, placeboing yourself, talking to yourself more softly and gently, perhaps worrying less, reducing the chemical stress from overactivation of your sympathetic nervous system, lessening the secretion of adrenaline and cortisol into your bloodstream, like we discussed in video 7. And it wasn't by medical intervention. It wasn't by avoiding certain foods or taking supplements. It was by thinking less and communicating with your own mind and body in far more effective ways, understanding yourself better. You could say you are slowly seeing a more complete map of the very complex relationship between the unconscious, the conscious, the body, the conditioning of our mind, and trapped energy from childhood trauma. Plus, the story of who we think we ought to be, which could also be called our identity, with all its learned behaviours, values, beliefs, behaviours, some of which may not be good for our own emotional well-being. By having all your processes in as much harmony as possible, you'll benefit from reduced biological stress. And with your immune system spending more time parasympathetically activated, you are naturally repairing and recharging yourself and reducing inflammation around the body. So I'm going to explain many of the symptoms of anxiety and a breathing technique that you can use to calm yourself down and continue on your journey of finding more calmness. Remember, I'm not medically trained. I'm an engineer, a therapist, a deep thinker, an avid researcher, and a person who has both experienced and recovered from anxiety, OCD, and depression. And I've listened to thousands of people talk about their experiences, and I'm documenting all the underlying patterns I've seen and detailing for you what worked for me. Of course, you should always be working closely with your own doctor, as well as trying these new ways of understanding yourself. So, as we go forward, I'm going to use non-medical concepts to help you get a better grasp on some of the symptoms. And I'm urging you to do your own research, because the medical world seems to be treating the symptoms of anxiety, but they're not necessarily addressing the underlying causes of those symptoms. Let me give you an example. A sedative may calm your symptoms of anxiety down, but it's not treating the underlying fear of conflict or being judged or being afraid to stand up for yourself. So let me remind you, first of all, about a couple of things. Emotions are your unconscious mind's way of telling your body what it thinks is good or bad. This is done by a gentle or a harsh release of chemicals which agitate your internal organs, which mean yes, move towards, or no, move away from. And as I keep saying, we are emotional creatures who learn to think. And if you are acting like a thinking creature who is trying to control their emotions, it's just the wrong way round, and ultimately it will never work. Therefore, if you're afraid of your own feelings, even though they're currently out of balance, they are your natural unconscious yes-no communication system. So it makes sense to focus on and recalibrate rather than to avoid your feelings and emotions. which is why the exposure therapy from video number 8 is so very, very important. Secondly, the body is a bit of a one-trick pony. If it releases adrenaline while you're taking off in an aeroplane, we might call that emotion anxiety. If it releases adrenaline as you kiss someone for the first time, we might call that a wonderful, exciting and moving experience. Or if you're parachuting, we might call it an exhilaration, a thrill, a rush, or we might call it terrifying. In all these different experiences, your heart raced, you had butterflies in your stomach, your mouth went dry, you sweated, and your body trembled. It was only your interpretation of the moment and your interpretation of the unrequested stories in your head that classified the event as good or bad. And even then, which aspect of your mind was interpreting and classifying? One part of the mind may be thinking, hey, I look really cool in my parachute suit. Yet at the same time, another part of the brain is trying to stop you from leaping out of the aeroplane to keep you safe. I guess what I'm pointing to here is we need not fear our emotions. Overwhelm to one person is exhilaration to another. So how can we begin to accept that we can't overly control our emotions? And how can we give our emotions less meaning? How can we begin to see them differently? Emotions are our unconscious mind giving commands to the body, preparing us for what it expects to happen. It nudges us forward to that which we need, like food, connection, reproduction, and safety. Remember, our brain, it sits in the darkness of the skull, making blind interpretations from the input from our various senses, our movements, our tonality, our speed of talking, and from however our amygdala was trained to react in the past. The brain makes a best guess interpretation. And what it comes up with is not necessarily the truth. So it would be very beneficial for us to take our emotions less literally. And this works in both ways. Just because you feel down doesn't mean you shouldn't do something. It just means that you feel down. So, a good place to start our exploration is with our adrenal glands. These are mushroom-shaped organs that sit on top of each kidney. And they can, in a fraction of a second, secrete adrenaline directly into our organs and into our bloodstream to give us emotion and physiological internal reactions. And for the sake of clarity, I'm going to group all the many different chemicals, hormones, adrenaline, cortisol, peptides. I'm going to group them all together, okay? And I'm just going to refer to them all as adrenaline. I know this is a really loose description. However, we explored cells and peptides and receptors in video 7. And in the next video, I really hope to shock you, hopefully in a good way, about the incredible and complex things that our bodies can do. So back to anxiety. The more anxious we feel, the more adrenaline our body will release. So if we're panicking at the thought of panic, we are of course making things even worse, which is why I've been asking you to sag your body, consciously talk softly over the unconscious negative fearful talk, and where possible to trick our senses that are feeding our brain, which as I said sits in darkness guessing what to do. And as adrenaline is released into our bloodstream, it immediately affects the muscle groups around our heart, which in turn begins to pump faster. Arteries and veins dilate to allow more blood to flow around the body. And of course, this is all in response to the old animal instinct of fight or flight. Our body is sensing danger and is preparing the muscles in our body by flooding them with aerated blood to make them primed and ready for action. Now bear with me here because I'm not stupid. I know this is common knowledge, but sometimes we just need to be reminded of just how normal the symptoms of anxiety really are. These are the right emotions. They're just firing off at the wrong time and at the wrong intensity. Your heart may pound against the chest as if it might explode. However, this is just the heart being efficient and forcing more blood through on each beat this is nothing to be afraid of. Your heartbeat may in fact rise from about 72 beats per minute to about 160, maybe higher. And although this may feel scary, for a relatively healthy person, the heart is capable of operating at 160 beats per minute for long periods of time. In fact, it's a good exercise for the heart muscle. Difficulty breathing is often encountered too. Your chest may constrict, feel tight, almost like a crushing feeling, making it hard to breathe. Well, this is caused by chest and diaphragm muscles tightening due to the presence of adrenaline, which naturally causes muscles and fibrous materials, such as your lungs, to stiffen and tense up. So it feels like it's harder to breathe, but actually nothing's wrong. It's just a bit tense. And many people, especially men, during panicky moments of fear, they often fear they're having a heart attack. And they may even be so scared that they end up in hospital, only to be told that it was only anxiety. And for some people, this is really hard to accept. This diagnosis, it just feels like there's definitely something wrong. Okay, and the doctors gives them an all clear, but they still don't trust that there isn't something wrong with their hearts. Okay, this is really, really common. Okay, and a quick comment here on the word trust. Can you begin to trust your own body a little more? Your body was designed to keep you alive without all your conscious thinking interventions. When you were a baby, you stayed alive, you grew. You didn't even know how to worry. It just did fine. And I truly believe that we need to get out of our own way. I remember my first full panic attack. It was on an aeroplane, and I was convinced that I was having a heart attack. But it was really just the effect of nearly all my adrenaline being dumped into my bloodstream in about 1 second. Looking back on it, through the whole panic episode, although I really thought I was going to die, I was probably just as concerned about what everybody else in the cabin was thinking about me freaking out. And I think worrying about what others think of us is a big part of anxiety. And I will be teaching you many new ways to increase self-esteem, self-worth, and self-confidence in future videos. Panic attacks typically cause people to breathe shallow and very quickly. And this causes more oxygen to enter and more carbon dioxide to leave the body. And that creates an imbalance. And this is important to understand because carbon dioxide is required to facilitate the chemical reaction that permits the oxygen to pass into the bloodstream. So to avoid hyperventilation, we need to take long, slow breaths in, and we need to ensure that the long, slow breaths out completely empty our lungs. And it's best to begin this slow breathing the moment the feelings of anxiety begin, or even better, learn to breathe deeper and slower all through the day anyway. And I would really recommend you explore diaphragmatic breathing. You can Google it, there are lots of videos out there. And to know if you're breathing properly, you place one hand on your chest and one hand on your stomach, and you take a deep breath in, and you see which hand moves. And we want it to be your stomach moving, not your chest. And for me, what worked best to calm me down was to sit down, if possible. If not, I would just lie on the floor, or I'd lean against something so I could just slump my body. Remember, we're trying to fool our own brain by physically pretending there's no problem out there. If we are all tense and restricted, the message that we're sending to our brain is that there's a problem out there. Remember, our brain sits in darkness. It's getting all its information via our senses, okay? And if we're doing all this, it thinks of bad things happening to us. So I would, as best I could, slump my body, if it was safe. I would close my eyes, if I could, and I would take long, slow breath in until my lungs were full. And then I would breathe out slowly with some slight resistance from my pursed lips until my lungs were totally empty. So it's kind of like this. And And when you've completely expelled all the air in your lungs, what happens is your own diaphragm pulls the air back into your lungs. Then gently and slowly blow it all back out again, okay? With the same slight resistance. Okay? Don't worry about counting how long it takes. It takes as long as it takes, okay? And you're keeping a percentage of your conscious mind focused on the resistance you feel against the inside of your pursed lips, like this. You really feel it. So if a part of your conscious mind is focused on the pressure at your lips, there's less of your mind that can be hijacked by all the fear stories. Remember, we're just trying to work smarter. You breathe all the way out until there's nothing left in your lungs, and then you let your own diaphragm pull all the air back in. You'll need to work on this. You'll need to practice this. And for some people, when anxiety comes on, a feeling of lightheaded or dizziness may be experienced. I used to have that, but for some reason it didn't bother me. I used to think, well, it's just my anxiety, but other people can get really, really scared. I suppose we're all different. But the reason it happens is because blood pools down from the top of our body via gravity as all the arteries in our legs and arms dilate to facilitate the delivery of the blood to our large muscle groups. If you feel lightheaded, sit down or lie down. And I'm also asking you to not be afraid of doing whatever you need to do, regardless of your situation. I remember being really impressed at a business conference when the keynote speaker, halfway through his speech, asked for a chair. And they brought one out next to the podium, and he sat down. And he said, sorry, I feel a bit lightheaded. Public speaking still makes me anxious, even after all these years. And he just smiled, and he carried on with his lecture, sitting down. And I love the fact that even though he had anxiety, it didn't stop him. Plus, I really respected the way that he wasn't embarrassed by it. It was courageous. Because why should he be embarrassed by it when anxiety is a normal part of the human condition? I say we should be more wary about people who never get nervous. So as we begin to panic, blood gets drawn away from our hands and away from our feet to facilitate less pain should we need to fight anybody or get bitten or run across rocky land. And this naturally causes a numbness, a tingling, pins and needles, temperature changes. And for some people, this might feel disturbing, especially if you're driving. But it's a natural response. When I was a child, I used to like laying on my arm until it went numb and floppy. And I strangely enjoyed the shocks and the zaps and the temperature changes, and as all the blood had flowed back in and everything sort of was reoxygenated and started working again. Other people hate that sensation. It's just a perspective. One view makes you feel bad, the other view makes you feel good. I'm really asking you to just accept what's happening in that moment. Detach from having an opinion, detach from having a story, an expectation. It is just what it is. And when anxiety escalates up towards becoming panic, there's a certain threshold where we consciously lose control and suddenly we just become totally overwhelmed. The reason this happens is because the blood vessels supplying our prefrontal cortex, or the thinking mind, they become restricted, causing our midbrain or our hindbrain to take over executive control. And this allows us to react from instinctual, quick, animal-like responses that keep us alive, rather than wasting time thinking about a situation. Should I do this or should I do that? No, it's just bam, we react, we respond. And in dangerous situations, this is good. This also explains why we often do silly things, or we lash out, or we get angry, or why we can't listen to any advice in those moments, because the thinking mind was turned off for our own safety. Then afterwards, when the thinking mind comes back online again, we wonder why we acted that way. But know that really you had no choice. Therefore, it makes complete sense to interrupt the anxiety as soon as it starts bubbling up, or even before it starts, if we know we're about to do something that may invoke our own fear. We talk softly and slowly. We sag our body. We start the breathing processes. We become the observer. We let go of control. Remember, as I said in a previous video, you can only respond, retreat, or accept in that moment. And how will you know what to do? You won't know until that moment happens. Where appropriate, we start the tapping that we explored in video number 8. There are so many options available to us. However, we need to practice them when we're calm, so that as anxiety comes on, they're already second nature and we can just move into them. If you experience a tight head or a stress headache, it's often due to the many muscles in the scalp contracting and tightening, causing a feeling of tension around the head. People say, I felt my head was in a vice. Just so you know, the pain is on the outside of the skull and not within the brain, because the brain has no receptors for pain. And for some people, the adrenaline causes like a blurred vision as the tiny delicate muscles at the back of the eyes used for focusing become more rigid, and later they ache, causing what feels like a sort of a frontal headache. Nausea, a churning stomach, and a knot in the stomach are all very common symptoms of anxiety. And the unconscious nervous system has many feeder systems that run into your stomach. These each gently release small drops of adrenaline during times of anxiety onto the structure of the stomach, causing it to continuously contract and restrict randomly. And this is natural, and this is the feeling that we call butterflies. It alerts us to pay attention, something's happening out there. And as our fears rise, more adrenaline is released, but it no longer drips into our stomach, it begins to flow into our stomach. And this causes our stomach to stop digestion, because in that moment, our survival is more useful than digestion. And with more adrenaline flowing into the structure of our stomach, it contracts and it shrinks and it feels like it's knotted. And what was only a half full stomach suddenly feels full. And this is what causes the feeling of nausea. Or you may have this feeling that you may vomit, which of course could kick off more anxiety, more worrisome thoughts, which of course kicks off a further release of adrenaline. You see how these things pile up? And a dry mouth is very common too, because as your digestion is halted, our saliva glands cease working, thus making our mouth dry. We can also experience this when we have to speak in a meeting or in public. Give it no meaning. It's completely natural. I was taught that if you're about to present to an audience, you should stand up, take 3 or 4 seconds to nod, smile, engage with everybody, then take a sip of water, and then begin your speech. It always works really well for me. When I'm presenting, my goal is not for my body to feel calm, but for my mind to be okay with any bodily discomfort and to not give it any meaning. I can be calm in my mind even if my body has been emotionally triggered or is anxious in some way. Now, another scary symptom is the effect of adrenaline on the back of our throats, where we have a muscle called the globus muscle. This is like a half egg-shaped muscle that sits at the back of our throat. And during anxiety, the adrenaline makes it swell and stiffen, making it feel like your airways are closing. And sometimes it causes difficulties in swallowing. It feels like a lump in the throat. And medically, this is called globus hystericus. And many people with OCD have this without realizing. So erroneously, they feel the need to breathe in certain ways or swallow in certain ways or count various numbers and things, and hoping that all the little mind tricks they're playing are avoiding it being triggered. But it's pretty natural. It's uncomfortable, but it's not going to kill you. And much like the stomach, our intestines, bowel and colon are also subject to the continuous agitation caused by the release of adrenaline. And this stirs things up, which releases gas, bloating, wind, and in extreme cases, diarrhea, along with the subsequent fearful story that you might get caught short, which actually adds more worry. In the wild, animals under attack immediately defecate as a distraction in the face of the predator and to make them lighter so that they can escape faster. And I think this basic system is within us as well, though we really need it these days. However, if the body is subjected to long bouts of anxiety, it plays havoc with your system, and we may call this IBS, or irritable bowel syndrome. And another note on IBS, rarely have I met a person with IBS who's not either a worrier or stressed or both. It just doesn't seem to happen to calm, happy people. So a good question that you might want to ponder is, what are they doing differently? Well, they worry less. And as the waste in your body nears the end of its journey, it enters the colon, and this rises up the right-hand side of your lower abdomen, across to the other side, then drops down where it can be released from you. And this vertical rise on the right-hand side, just under your ribs here, often traps gas and can cause transient pain. And many in particular really fear this sensation. But it's okay, it's pretty natural. Now, I'm not saying people don't have intolerances or allergies. What I'm saying here is you may need to go deeper than just diet or supplements and medication, and really explore how your intestines and bowel system would respond to a quiet mind, minimal adrenaline release, and loss of relaxation. Have you noticed how intolerances and allergies diminish during times that we're less stressed? Like in the mid part of a vacation, where the worry of getting there is over, and just before you start worrying about coming back home again. And another common symptom is the need to urinate when anxious. Once again, adrenaline shrinks in some people the body of the bladder, making it instantly feel full, even if it was only half full. You rush to the bathroom, but hardly anything comes out. Why? Because it was only half full in the first place. And then you start a cycle of what if worrying about what if I need the bathroom, what if that train journey is too long, which makes the whole thing worse. Many people tremble or shake when anxious, and this is just the adrenaline rushing around the bloodstream, continuously contracting and relaxing whole muscle groups. And of course, the more worked up you become, the more adrenaline is released, and the more you may shake. It's completely natural. And as the release of adrenaline abates and its effects wear off, so does the shaking, and you calm down again. If during the day you're releasing more adrenaline through worry and stress than the body can burn off, that which remains tends to accumulate around the neck, the shoulders, and the upper back, causing tension, stiffness, and various aches and pains. You go for a massage, and this stored adrenaline is released back out of the muscles into the bloodstream. Okay, your shoulders relax, your neck relax, and it feels good. But this is just temporary respite, because usually within a couple of hours it just returns, because everything is still in your bloodstream. Unless you've taken the action to burn it off, exercise it off, or more sensibly, think and worry less to stop it being released in the first place. So many symptoms of anxiety can be hidden. People can't see if you have a headache. However, if you suddenly become all sweaty, it can make you very self-conscious, okay, or even more anxious. However, sweating is an absolutely natural part of the fight or flight response. Sweat glands are stimulated to begin to pre-cool the body in anticipation for a huge expenditure of energy. In biological terms, it makes complete sense. Our hands may get damp and sweaty, our forehead, our brow, our neck, across our chest, our back here. It can be very disconcerting. Yeah? It's just your biology doing what it needs to do. Okay? And actually, this could even affect blushing. Your face or your neck goes all red, which makes you feel even more unconscious. But it's just the blood coming to the surface, ready to pre-cool. Okay? Also, night sweats in response to anxious dreams. If we stay with dreams for a moment, anxious or depressed people seem to dream twice as much as calm people. I think it's probably something to do with the unconscious mind trying to figure things out as you sleep. And if you are unconsciously dreaming all night, it's not uncommon to wake up already feeling anxious because, like I said in earlier videos, your body thinks your dreams are real and gives you corresponding emotional responses. You wake up thinking the anxiety is about what's coming up, when actually it was from the dreams that you just had, often which you can't even remember. And for some people, adrenaline makes the jaw tense and may cause clenching or grinding of the teeth while you're awake or even while you're sleeping. So I've been talking about here the physical symptoms of anxiety. However, I think scary thoughts, intrusive ruminations, a catastrophizing mind, and worrisome what-if stories, I think these can also be classified as symptoms of anxiety. They will get their own video, in fact many videos, because I'm going to teach you what they are, how they operate, which parts are you, which parts are not you, and what you can do about them to quieten them down, or at least to be able to ignore them. And as you think less, worry less, as you recharge your emotional battery, as you discharge your atomic battery, as you relax more, as you let go of control, as you retrain your amygdala, as you learn to breathe properly, reduce pumping adrenaline into your bloodstream, your unconscious, your little 8-year-old will slowly back off from sabotaging you, and you will begin to find glimpses of calmness. So, your homework. I want you to practice the breath work I talked about earlier. Deep, long breaths out through pursed lips until your lungs are completely empty. Focus your mind on the slight resistance as you do this. Then let your diaphragm pull the air back into your lungs automatically. And as you continue the breathing, sag your body, surrender to what is, unhook from your unconscious stories or your what-if stories, either by talking over the top of them with a new calm placebo story, everything's fine, it's okay, or just by totally focusing on all aspects of your conscious breathing. Ensure that all sensory feedback to your sitting in darkness brain is as consciously modified as possible. Sag your body, close your eyes, drop your arms, slow your breathing, a soft, gentle, conscious dialogue. These are the only conscious things you can do. Everything else is unconscious. Okay? Stop trying to argue with or understand your own unconscious mind. Just bring your awareness back into your consciousness. Learn that consciously you can be calm in your mind regardless of what your body is doing. There is in fact a stillness in there, which I'll teach you how to find if you haven't already stumbled upon it. Now the next video is a big one, and I'm going to bring in one of the most important missing links into understanding why pain, exhaustion, stiffness, sinus problems, IBS, headaches, joint inflammation, and skin conditions occur, and why the medical world struggles to explain or effectively cure these conditions. I'm really looking forward to that. Until then, I'd like you to work on your breathing, and I'll be seeing you in the next video. So thanks a lot.